Hi everyone, welcome to my poster presentation. My name is Barbara Orth. I'm a PhD researcher at the Free University of Berlin, where I work on care platforms. I will now share my poster presentation so you can follow what I'm saying visually. And I will start by giving you just a brief overview of what I'm going to be talking about. First of all, I will give you a brief bit of background info on what care platforms actually are. I will then look at some research gaps in platform research when it comes to care platforms, and then highlight some of the methodological challenges of engaging care platform workers, as well as some possible approaches or solutions that I employ in my own research. Well, let's start off with what actually do I mean by care platform. Care platforms in my book refers to any gig work platform that offers household related services and domestic services in the physical space. So I'm not looking at crowd work when I say that. These services could include anything that is related to household chores, for example, babysitting, cooking, cleaning, but also, and perhaps importantly, actual care work in terms of light nursing services. So that would be maybe companionship for an elderly person, grocery shopping, or watering their plants. Now, why are these platforms interesting or important is probably politically quite clear. We live in industrialized countries in which there is a growing aging population, and the demographic changes require us to think of more creative solutions when it comes to care and providing care. And so both governments as well as private investors are investing a lot of money into care startups that offer various services. For example, the NHS is looking at digitizing various aspects of care, including staff models that include gig work that we know from other lean platform models. Now, why are these things interesting to study apart from the fact that they're socially relevant in our societies? What I think care platforms are quite different from other types of platforms, and they haven't really been researched yet. So most platform research today is on ride hailing and delivery when it comes to gig platform that takes place in the physical space. And these sectors are quite different. One, they're quite male dominated, so most riders and drivers are men, whereas in care, unsurprisingly, most people who provide care are women, both unpaid in people's homes as well as paid care workers that work in other people's homes. Of course, they're often migrant women, people, racialized people, people who have difficulties finding other jobs, as is the case with a lot of other gig work as well. And secondly, the platforms employ a very different business model. So whereas Airbnb and Uber really try to break apart monopolies and try to make formal requirements like the London cab license or the New York cab licenses more accessible to everyday users, care platforms work the other way around. So care is a largely informal sector. Very few babysitters have job contracts. Very few people take care of an elderly person, get paid at all. And care platforms really try to make something that's informal quite formal. And that brings me to maybe the most interesting aspect of care platforms that I would like to focus on today, which is how do these different business strategies and labor force aspects actually work out in a technical sense. So as you probably know, Uber and Deliveroo, delivery services in general, use geolocation-based services, and you have an algorithm that matches you with just the next available worker / customer. So it doesn't really matter who you are as a worker. You have a rating that's supposed to be fairly high, so it means you have to work a lot and you have to be quite fast, but who you are as a person doesn't really matter. For care platforms, on the other hand, who you are really matters. So care platforms have design features where they really highlight a work's personality, including visual aspects. So there's a lot of photos, descriptions, also reviews and recommendations by former clients. And on a technical level, it also works differently. So instead of having a geolocation-based matching system, they have sorting algorithms. So as a customer, I have a job and I get a list of, say, 50 people who are available and willing to do that job. And now I have to pick the person that I think is most suitable. And as you can imagine, of course, you're not going to look through 50 different profiles, but maybe the first 5. And then the personality and how that comes across on a profile actually matters. So I would argue that then raises a lot of questions for how these technological interfaces actually impact workers. And because we're talking about organizing and lived experience of workers at this conference, I would like to highlight some of the research gaps and questions that I have with regards to care platforms. So one is, perhaps unsurprisingly, do these care platforms actually amplify existing inequalities? So one might expect something like ageism or lookism because of the visual the centrality of the visual in these profiles, but it could also be linguistic. So would you give a babysitting gig to someone who has spelling mistakes or who doesn't speak your language natively? Then also race and class, of course, as always, but maybe things that are a bit less obvious. So legal status. A lot of babysitting or nannying jobs especially are done by people who are not documented and who are not legally resident in the country they're working in. And when you work through informal networks, as is traditionally the case in these industries, then that maybe doesn't matter so much. Maybe your employer doesn't know that you're undocumented. But when you're on a platform, you put yourself out there with your real photo and perhaps with your passport info, as some of these platforms require you to do. So does that endanger workers in a particular way that we don't see in traditional domestic work, even though that's already very precarious? And the same visual aspect also could impact workers' strategies to mitigate precarity. So we know that Uber workers, for example, actually share their accounts either commercially, selling an Uber login on Facebook, but they might also just use it to hedge against, illness. So I'm sick one day and my rating will go down if I don't drive, but I can maybe pass on my account to my cousin, who might then drive and make sure that we're not penalized for it later on. Does that work when your profile is really visualized? Does it work when it's really about your personality? Probably less so. And then how does that affect workers is my next question, right? So I'm talking for myself now, but I'm sure others experienced similar things. I mean, I have stopped counting how many times I've tried to take this video for a conference. And of course, speaking at a regular conference without recording a video, I wouldn't do 15 takes, right? I would do 1. And so you probably all have an idea of what it means to really have to have a perfect presentation of yourself out there to get a job. Well, in this case, a conference gig, but you know what I mean. So we can imagine how much emotional labor goes into this kind of work before you even apply, so to speak. And I think that in general, we just need like a more intersectional analysis of who these workers are and how they're affected. If a workforce is more feminized, then of course things like care responsibilities and reproductive labor play a huge role. If you're working as a nanny, you have your own children, you might be a single mom, you might be a single parent, although, I'm deliberately using the phrase single mom because the majority of babysitters are women. So like, how does that interact with your day? How does that disrupt your day maybe? I think these are all really important questions that we don't really get from looking at ride-hailing and delivery as proxies for the gig economy as a whole. So of course, there's a reason why people don't research care platforms as much as they research other platforms. And it's because it's really difficult to do, I think. Platform work is seen as difficult to research to begin with. Organizing platform workers is really challenging. But I would argue that at least in ride-hailing and delivery, you still have central meeting locations. People are picked up and dropped off at certain locations. There are petrol stations. There might be restaurants that are really popular where riders meet. You don't really have that in domestic work because people are very individualized. They work inside the private sphere, inside the home. So it's really hard for domestic workers to meet each other, and it's also hard for researchers to then find domestic workers on platforms. Platforms prevent workers from interacting, so snowball sampling is also very difficult. Contacting workers through the platform itself might be very risky to the workers. If you publish anything that's critical of a platform, then their accounts might be deactivated if it's clear that you talk to them. So these are all the challenges that I foresee working on care platforms. And now I want to offer some solutions or ideas I have for mitigating these. I'm a migration researcher myself, so I draw heavily from work on migration and domestic work in my research on care platforms. And I think a lot of these methods might be familiar with to many of you. So community-based approaches and participatory action research approaches. So that means not only researching, but really trying to see what you can give back to communities and how you can shape your research questions in accordance to their needs. And I think an overall really important point is to really pay research participants. There is a huge discussion about this in refugee and forced migration studies, whether you should pay someone or whether that will create an added incentive for them to tell you whatever you want to hear. But I think it's really, really the opposite is true. If you ask someone to share their time with you and they live really precariously where they're paid per gig, then it's imperative to pay them. I think you also have to be very sensitive to legal status when you do that. So undocumented people might not have access to bank accounts or an address where you can find them. PayPal accounts might charge fees that people can't afford. They might be on benefits, in which case any transfer to their account could be deducted from their welfare benefits. So you need to be really sensitive to how you engage with people. And then I think, if one thinks as gig labor as a precarious form of labor, and lots of people who work on gig platforms being migrants or ethnic minorities, then going through community-based approaches might be more sensible. So that could be organized diaspora groups, faith-based groups, but also language learning groups. And this could be in the physical space or in the digital space. I think once we find people, we also have to be flexible in our methods. So for some people, if they don't speak the language that you're speaking as a first, second, or even third language, then maybe visual methods can be a way out. So in migration research, we often use mind maps to understand how people's daily lives in a city are structured and how they manage their journeys across to wherever they live now. So I think this can be a really important approach, along with other things like, recording, letting people do voice recordings instead of writing research diaries, and doing one question at a time that people can answer through voicemail. And so it takes up less of their time and they can do it on the go, on the way to a job, and it's less intrusive. I think overall, the biggest takeaway is that, pay attention to the community you're engaging with and try to give something back. Make sure your research is actually relevant and useful to them. And in my research, I've had a lot of success with that. Engaging community leaders, particular linguistic groups on Facebook has been really helpful in finding people. And I really hope that I was able to make a good case for why it's really important to research care platforms, even though it's cumbersome and sometimes difficult. and I would love to hear your thoughts on my presentation, my research projects, my hypotheses, my research questions. So feel free to reach out to me on Twitter, on my email, or just ping me at one of the other Zoom talks. I'll be at most of them, and I'd be happy to get a direct message from you or hear from you in any other way. Thank you so much for listening.